The Senate Rules Committee has recently taken two significant actions in aging and disability policy. First, they established a new select committee on aging and long-term care and named Senator Carol Liu as the chair. And second, they named Senator Liu as chair of the Human Services Committee while she's still chairing the Senate Education Committee. Now, how is this possible, you might ask? Well, it's possible because she has a great chief of staff. She's the consummate chief of staff because you've probably never met her. You don't see her out giving speeches. That's not her job. But her job is to make sure that this one of 40 people who can vote on all of these issues and make decisions every single day is well prepared, every single day, for all of these many decisions that this one of 40 Californians in the state Senate gets to make. Suzanne works as hard or harder than anybody else in the office. She maintains her own expertise in a particular area of the environment, but still knows about all the other issues that the staff and the senator are working on. So it's my great pleasure to introduce Suzanne.
Hi, thank you. I don't think I've ever had such a nice introduction, and I sincerely appreciate it. It was my great pleasure to work with Jack when Carol first came to the Senate in 2008, and she at that time was named Chair of Human Services. Even though she moved over to chair the Senate Education Committee, she remained a member on the Human Services Committee because as part of her overriding agenda, and an agenda I have to say that I've always been Carol's chief of staff since 2000 when she was first elected to the Assembly, and we actually first came to know each other when we both lived in the same community in Southern California, and I was privileged to run her first campaign for city council in 1992. So our relationship goes back a long way, and it's a privilege to work for her on our strategy, no matter what the agenda item is, whether it is education or making sure that those who are most vulnerable or at risk in our society have the services and supports they need, is to develop a vision for what it should look like. And then the other aspect or characteristic of a person that wants to be effective in the legislature is to have patience, because you can't always get what you want. And so you have to be willing to incrementally just work away at the issues. And that's the focus with which Carol has held this office and been a champion for the most vulnerable in our society. Also, while it seems a disconnect between my area of expertise in academic and professional training in energy and the environment and transportation, as an ecologist and Carol as an educator, we share a holistic view of the world, and that all issues interconnect. And in our case, that education is a key to upward mobility, to eradicating poverty, to reducing the rate of incarceration in our prison system, and to create a better community and a higher quality of life and sustain that quality of life for everyone in our society. With that, she was pleased to have the Senate create a select committee on aging and long-term care. You may know that the Assembly has a standing committee on aging and long-term care, while the Senate has the Human Services Committee and then the Health Committee. And so this is an opportunity to highlight this issue, especially in light of the fact that I have to say Carol and I are both seniors in the 65 and over category. And so we're very well aware of the coming baby boom barrage into our population. But not only that, but also that there are generations to come of aging. And so we not only need to meet the needs of this current aging population, but also prepare a better system for dealing with aging and disability issues for the longer term. So again, to create a vision for what such a system would look like, and then lay out a strategy for meeting those needs that's both on a short-term and then a longer-term basis to help us get there. So Senator Liu is chair of the Select Committee on Aging and Long-Term Care. The members are Senator Ed Hernandez, who also chairs the Health Committee. Senator Liu is doing double duty as chair of the Human Services Committee as well as chair of the Select Committee. And then Senators Richard Roth, Lois Wolk, and Mr. Tom Berryhill. The Select Committee intends to articulate a vision for an effective and efficient aging and long-term care support and services delivery system, and to develop a comprehensive strategy, both short-term and long-term, to achieve that vision for our aging and disabled population. In the process, the committee wants to change the conversation in California about what is aging, how do different people age, how they do and continue to contribute to society, what they need, and what that means for California. The committee will be exploring health insurance in light of the Affordable Care Act, health care delivery, housing, transportation, mobility, employment and retirement, wellness and mental health, caregiving, transitional care, long-term services and support, elder and disabled justice and abuse, and dementia and Alzheimer's disease. Former Assemblywoman Patty Berg, who chaired the Assembly Committee on Aging and Long-Term Care, is the committee consultant. She will be assisted by Sarah Steenhausen, courtesy of the SCAN Foundation, thank you very much, and Tony Gomez of Senator Liu's Capitol staff, who's just joined us in the back of the room. Wave, say hi, Tony, to everyone. So this committee's goals are to establish a new cultural vision by asking, how is aging perceived in today's society? How has the aging population changed from one century to the next? Or more precisely, from the population as it was perceived when the current system was put together. What does it mean to be old in America and California today? What are the myths and realities of aging? And what would it take to change the perception of aging from negative stereotypes to positive prototypes that aging and elders are valued by our society? Establish a new structural vision by stipulating that we do not currently have a viable support and service delivery system. A key question that we'll be asking and exploring that issue are, who are the consumers? What are their needs? And how do we create a system that ensures access, affordability, continuum of care, maximum independence, flexibility, and choice? The committee also seeks to establish effective partnerships among the aging and disability communities, and certainly this collaboration has taken us a long way to creating that network. But we also want to talk about collaboration at the regional level. And what is the potential for regional collaboration to coordinate the assessment of needs and delivery of services? We want to establish an advocacy network by linking organizations at a local, regional, and statewide level, and encouraging creation of a shared agenda, an ongoing exchange of information and best practices, and coordinated outreach and advocacy programs. So our activities have begun, and they include not only our own independent research, which will also include profiling California's current aging and long-term care and support service system, which seems to be a rather dense and sometimes obtuse labyrinth of organizations and acronyms, not all of which I'm familiar with at this point. We're going to update and disaggregate the profile of Californians age 60 and older to reflect not only age, ethnicity, gender, and income, but also marital status, health, family status, and the logistics. Where are they located? Are they in an urban setting, a suburban setting, or in a rural environment? We're going to conduct this year 2 informational hearings. One is scheduled in Glendale on July the 8th, and we're invited stakeholders and expert witnesses to explore consumer needs, current research on aging, best practices, and model programs. And then in Northern California, we're having a hearing in August on August 12th in Sacramento, and that will be a joint hearing with the Assembly Committee on Aging and Long-Term Care. Through these hearings and additional input from you and other stakeholders, the committee will articulate a vision for an optimal aging and long-term care system for California. We will develop an implementation strategy, both short-term and long-term, that includes legislative, administrative, and programmatic strategies and tactics to achieve that ideal vision. At the same time, the committee will develop consumer-focused criteria such as access, affordability, independence, integration, flexibility, and choice for evaluating the effectiveness of systems and programs and the effectiveness of pending and future legislative, administrative, and programmatic changes. So, to conclude, the Select Committee approach is to view age and disability on the spectrum of a continuum of care, of wraparound services from birth to death. Different people will have different needs, some from the very beginning, but for others, new needs will emerge as time goes by. By taking this perspective, we can promote aging well and preventative care and maximum mainstream access. That being said, the committee will focus first on making sure the needs for our most vulnerable are met. From a longer-term point of view, we now know many ways to keep people from falling into the most vulnerable and disabled category by addressing issues and providing resources for mental, emotional, and physical health, and promoting prevention of debilitative conditions like diabetes, heart disease, obesity, and the onset of depression and alcoholism. In short, the committee plans to develop a blueprint to improve the current system and meet the needs of our current aging and disabled population. At the same time, we'll propose an approach to help people age well in society, and a society that appreciates its elders and supports them to live their lives with dignity. So I'm happy to answer any questions that you may have, and thank you very much.
What you guys plan on doing there. I was going to ask you, you said you were talking about legislatively. The proposals that have come out from the aging and long-term care, what's been done with them, and what are you guys plan on doing with any? Are you guys going to sponsor any bills as a committee, or are you just going to let the members do that? And what do you guys see as a vision of legislation that could come out of this committee?
So, first of all, a select committee is not a committee that hears legislation. It's an exploratory and informational committee. One of the reasons that we have both the chair of the Health Committee and at this point in time, also the Human Services Committee, is because we do expect legislative proposals to emerge from the select committee's explorations. And that's the other reason that we're working in consort with the Assembly Committee, because we know that legislation is going to be a big part of the effort. So we're trying not to guess what the outcomes might be, because we're really trying to promote kind of a more open dialogue about what the possibilities are and not key legislative proposals to the existing system. So we are looking forward to that conversation. And but we don't believe that legislation is the answer to everything. And so sometimes there are things, when we look at articulating a vision, kind of the first thing we do is look at what is standing in the way of helping us realize that vision. And sometimes it's actually the way things are either currently administered, either through guidelines or regulations that have been articulated by an agency, and they already have the authority within their own means to change the way they're approaching a program or administering a program. And then there are also barriers maybe in code as to how some of these things can work. And so that's our first order of operation, is to remove those barriers and allow things to flourish before we get into anything that becomes overly prescriptive and reduces the flexibility that may be required in order to structure programs that can meet different needs, for instance, in an urban setting versus a rural setting. So that's kind of our sequential approach, learned over a dozen years here in the legislature as to how things can be done. frankly, one thing I often say is sometimes it just takes bringing two people into the office and knocking heads and saying, why are you doing it this why are you doing it this way, or why aren't you doing that? And, a case in hand was when, we went through the whole adult health care, issue, and really, which was tortuous. Really just asking a lot of questions and trying to get people to rethink the way they were going about implementing something at an administrative level. So that's kind of the approach that we take. So the legislation will probably not begin to flow until next year, and we'll have, introductions in January and in the January-February thing, and that's when you'll start seeing some proposals really moving through the system. At the same time, we've cut off a fairly ambitious agenda, as I'm sure you probably can perceive. And we're hopeful, even though select committees are only authorized a year at a time, that we'll actually be able to extend that work. The senator term's out in 2016. I'm following her right out the door. And so we really hope to leave in place a blueprint that others can follow, and a constituency and an advocacy base that's going to continue to fight for the vision that we've created.
So,
Stay for the part of the reception. Okay, great.
Yeah.
So we'll have one more question, and then we can.
I'm going to stick around for a little while.
Go ahead, Donna.
okay, thank you. Hello, nice to meet you, and thank you for your remarks. I've worked in the arena of long-term services and supports in both nursing facility and home care since the mid-'80s, and so I'm really pleased to see this Senate Select Committee put in place and maybe more focus put on long-term supports and services going forward. Patty Berg came to speak to the California Association of Public Authorities last month, and I said this to her there, and I'll urge here. In keeping with your notion of partnership and bridge building with the disability community, I would urge cultivation of more questions about disability issues, and maybe more focus on the kind of research that can be put together, because from my point of view, there's really a dearth of information about people with disabilities, and your committee would be perfect place. And with the agenda, I guess I'm possibly adding to your agenda, but it would be nice to see more fleshed out questions around disability issues and so on as they fit in with a notion that functionality is the way we should approach long-term services and supports, and not distinctions of age or diagnosis and so on.
Yeah, and I appreciate that comment. Patty shared it with me after she spoke to your organization. One of the things that I suggested is that, in particular, as Jack mentioned, this is not necessarily an area of deep expertise for me. As a chief of staff, I tend to be a jack of all trades, and so I become educated through these processes as well, which is part of the beauty of this job. So we may not know all the right questions to ask. Off the top of my head, at my view of 10,000 or 30,000 feet, it's, okay, aging and the disabled. What do they have in common whose needs we can address together? And then where do they diverge in terms of some unique needs? And I think we need a greater depth of understanding of exactly what that is. And so I request your help in helping us articulate some of the key questions and identify some of the key academics or the places where you think research gaps occur that could be incorporated into our activities. Thank you. Okay, I will hang around and hopefully talk to some of you later. Thank you.
Thanks.